Welcome back. It is time to Ask the Vet, where we try to get some of your questions answered about caring for your household pet. And joining me once again is Dr. John Faught from the Firehouse Animal Health Center here in Austin. And we talk about dogs a lot in this segment. Today we're going to be talking about cats. And who did you bring?
This is Monkey. Monkey's about an 11-year-old domestic short-haired cat.
Monkey. And we were talking during the break, there's kind of this misconception that, cats are pretty self-sufficient. They can kind of take care of themselves. They're indoors. And we have a viewer that wrote in, because her cat never goes outside, do they still need to get their cat vaccinated?
Yeah, I think this is some of the growing trends we're seeing in cats is that they actually say cat ownership is up, but cat visits to a vet hospital are down.
Yeah.
And I think part of that is that their cats have started moving indoors more than they used to be, and they're probably not getting into as much trouble that way. But there's also a misconception that they're just healthy because they're not exposed to these things.
Right.
And so used to you took the cat because they got hurt, and then they ended up, you found the other things that were going on with the cat at that time. And now, if they're not showing that, they're very good at hiding these things, so we don't always pick up on those things.
Right.
As far as the vaccines go, what we're seeing also, the trends are that we're really trying to do less vaccines over time, but that doesn't mean that if your cat lives inside that they don't ever need to be vaccinated ever again. It really is, it's just more of a, to me, it's a strategy you want to make on what's really the risk to the cat, and kind of challenge those with what are the rewards of the vaccines, and not underprotect them from the things that you can protect them against.
Sure, so you maybe can space them out a little bit more, but not ignore them completely.
Yeah, I think every, we try not to make global things for all cats. I think a lot of it is cat specific, and we want to try to figure out their lifestyle, what they're exposed to, and the demographics and the needs of the cat individually.
Another viewer, Mark, writes in, my cat always has black debris on his chin. What causes that?
Yeah, typically what that sounds like is what they call feline chin acne, and it's actually a little keratin that builds up on the chin of cats. Cats do a really good job of grooming themselves.
Right.
But that's a really challenging place because they can't lick and get it clean. So some cats, those pores get clogged, and when those pores get clogged, they can get infected. It turns into almost like a pimple on the chin. And so we really work on trying to use cleaning products to flush those follicles out and get them cleaned out and take care of any sort of bacterial involvement that may be there.
That could lead to the black debris on the chin. Tina writes in, my cat has hyperthyroidism. How did she get it?
Yeah, hyperthyroidism is a not uncommon disease we see in kind of middle-aged and older cats. Generally, what we generally suspect is that there's a microadenoma, so a tiny, tiny little tumor that develops on the normal thyroid gland, which activates the thyroid to produce more thyroid hormone. And the thyroid regulates your metabolism.
Right.
So when that goes up, things like weight loss are seen, vomiting, increased appetite. Sometimes the heart rate can go up, and even heart disease can be a secondary effect of that.
And is there a way to treat it other than pills, or is that the only way?
Yeah, I think that's one of the challenges. Is pills are a really common way of treating that, and a really inexpensive way of approaching that. But we do, for some cats, giving a pill can be really a challenge. So trying, there are some liquid formulations. There's actually a really cool way of doing what they call a transdermal gel, where you actually apply a gel to the skin on the ear, and it's absorbed. It's one of the only medications.
Like a topical medicine?
Yeah, it's one of the only medications that really works well and absorbs and levels that way. And then kind of the gold standard way of treating hyperthyroidism is there's actually some chemotherapy protocols with radioactive iodine that have to be done in a facility geared for that, but they can treat the cat over the course of a week or two and actually cure the disease in a lot of these cats. So
does that require anesthesia or no?
It doesn't typically require anesthesia, but there's a long-term treatment because those drugs and those chemotherapeutics are, have some danger because of the radioactivity to them. But the reality is that the cats tend to do really well with that treatment, so that you don't have to be giving them long-term medications.
Interesting. Dr. John Faught with the Firehouse Animal Health Center today, of course, talking about your household cats. If you have a question that you'd like to get answered, send them to askthevet@kxan.com. Thank you so much for being here.
Yeah, thanks for having me.
We'll be right back.